And we'll get started. So thank you for coming. We're here today to talk about back pain. So we'll get started with the presentation here. If I can advance the slide. Oh, there it goes. So this is the boring stuff. Basically, this workshop is not intended to diagnose or treat back injuries and is not intended to replace visiting a medical professional. So please enjoy the workshop, but if you feel like you have a condition that requires medical attention, please seek the appropriate practitioner. So I'll introduce myself. I'm Dr. Stephanie Soares. I'm the owner of Cape Cod BFit and Bike Fit based out of Marston's Mills. I help Cape Codders stay active through physical therapy, performance training, and bike fitting. So not too many people are familiar with what bike fitting is, so I'll just cover that briefly. Basically, I am able to modify the setup of your bicycle so that you're comfortable when you're riding. So that's a fun thing I love to do. So if you happen to be a cyclist or wanting to get back on your bike, I'd be happy to help you get comfortable and confident on your bike. So we're here to talk about back pain today, and roughly 80% of adults experience low back pain in their lifetime. So you have a range of experiences, a range of reasons why we have back pain, and that's what we'll go over today. So we'll go over the basic anatomy of the lumbar spine, so of your lower back, some of the main causes of back pain, and then how to avoid getting back pain or what to do if you already have it. So the lumbar spine or the lower back is made up of 5 vertebrae. So you can see these 5 bones here, and they're separated by discs, which in this picture are actually these glowing blue healthy discs. And those are basically your big shock absorbers in your spine are those discs. So it's important that they stay healthy. Between those discs, you can see these little yellow spaghetti looking things. These are your nerves. And so they help control the sensation and movement in your legs. So you'll notice that these nerves are coming out of these little openings between the vertebrae in your spine. And these are happy nerves because they have a lot of space to move around here. When they don't have that space, that's when we run into trouble. And just another thing about the lower back or your lumbar spine is it bears most of the weight of your body. So if you think about your skeleton, your lower back is having to support everything above it. So your torso, your shoulders, your neck, your head, everything is just pushing down on that lower part of your back. So we'll go into some common causes of low back pain. This is not an exhaustive list, but this, I think, highlights most of the main areas that maybe you've heard of before. So we'll start at the top here. Degenerative disc is just what it sounds like. The discs can wear out over time. What can happen is the height of the disc can actually decrease. So if you look at this model here, you'll notice that these are healthy discs. They're providing a lot of space between the vertebrae, which you can see are kind of nestled on top of each other. And in between those vertebrae, come out your nerves. So you can see that if the disc height is decreased, perhaps the nerves won't have as much room to move and operate as they would if you had a healthy disc. Other conditions for the lower back, osteoarthritis, similar to the arthritic process you may have in your knees, your hips, or anywhere else. Your spine is no different. In your spine, the joints are the articulation between the 2 vertebrae as they're sitting on top of each other. So it might be a little hard to see in this picture, but if you look towards the left here, the vertebrae actually sit on top of each other and they glide a little bit as our back moves. So that's where the joint is located. A herniated disc or a bulging disc. So that would be this little red area here that this pen is pointing to. So basically, some disc material has migrated outside of the normal location of a disc, and it can potentially press on a nerve. And that's when you'll feel those radicular symptoms into your leg. Sometimes you can have a herniated disc and not have any symptoms at all, but it just depends on the location and severity of the herniation. Another condition is spondylolisthesis, which is a tongue twister, but basically it just means that one of the vertebrae in your back has scooted forward a little bit on the vertebrae below. So depending on how much translation there is, or how much movement there is, sometimes these are asymptomatic conditions, or if it's a lot of movement, sometimes that can affect the nerve that's coming out above or below. Stenosis is another common condition of the lower back, and stenosis basically means narrowing. So you can have a narrowing of the canal that your spinal column goes through, or you can have a narrowing of these little windows on the side of your spine that your nerves exit through. So it's just giving a little less space for those tissues to operate. Another common cause of low back pain would be what's called occupational or postural back pain. And a lot of times this is more of a muscular condition, something that you've done or a position that you've been in for a prolonged period of time may cause the tissues in your back to be a little aggravated. So an example would be if you've been sitting on a plane for a long period of time, maybe you'll notice that the muscles in your lower back are feeling a little stiff or sore. Or if you've been raking leaves, you'll notice that the lower back tissues are a little aggravated. So that would fall into the occupational or postural category. And then the last category is more of a catch-all, non-specific low back pain. And this is actually the majority of low back pain falls into this category, meaning that you can't pinpoint the exact cause of the back pain. It falls into the non-specific category. So we'll follow up with just some of the back muscles, which would fall into that occupational or postural back pain. There are a lot of muscles in the trunk that are back muscles, but I just highlighted two here that are common causes or contributors of back pain. So the photo to the left here is called your psoas muscle. And as you can see in the illustration, it attaches to all the layers or all the levels of your lumbar spine. It travels down through the front of the hip and attaches to your lower leg. So if you're sitting for a long period of time, this muscle can get tight. And then when you go to stand back up, you might feel a little pressure in your back because this muscle has gotten tight. You're standing up and forcing it to stretch, and it doesn't want to stretch. So it'll pull your pelvis forward and cause a little discomfort in your lower back. Another muscle that is frequently involved in low back pain is the muscle group to the right here. So these are called your paraspinal muscles. And it's three muscles that run along the spine and are responsible for helping you with posture and extending your back. In folks who have back pain, very commonly, these muscles just feel like a very tight rope almost on either side of the spine. And that means that these muscles are tight and or aggravated. So these are two key muscles that I see a lot involved with back pain, but there are a lot of different muscle groups in the back region. So with this information, we'll go to what makes a happy back. So if your back is not painful and you're trying to keep it that way, Or if you do have some back pain, the same rules apply. So a happy back is mobile. So you have good mobility in the trunk, not only in your trunk, but also in your hips, your knees, and your ankles. All of those joints work together to help you do your activities throughout the day. So if one level is not moving as well as it should, then that can affect the joints above and below. Another critical factor is stability. So as you're doing things throughout the day, you want to make sure you're doing them in a way in which your back is stabilized. So that means activating appropriate muscle groups to give your back support so that you're not putting too much stress on the structures in your back. And then the last bubble here is posture, positioning, and body mechanics. Of these three things, this is something that you can change today to help your back and your neck and your shoulders and really all of your joints. So mobility and stability may take a little bit of time and repetition to improve, but posture, positioning, and body mechanics is something you can start working on today. And we'll talk a little bit more about that further on in the presentation. So let's talk a little bit about mobility. And I have two tests that you can do at home to test your mobility. So the seated trunk rotation test is essentially sitting in a chair with your feet firmly planted on the floor and your knees together. And once you're in this position, if you envision that there is an X in front of you on your tabletop or on your lap oriented this way, that will give you a good visual guideline of what we're looking for as far as rotation. So I'd have you cross your arms across your chest and then rotate as far as you can to one side. Now, as you're doing that, you want your shoulders to create a line that is at least parallel to this part of the X. That means you have a good amount of trunk rotation. And then you do the same thing the other way. So you rotate to the other direction and you're looking for your shoulders, the line between your shoulders, to be parallel to this part of the X. So that's a good test of mobility. The other common test for the mobility of your trunk is similar to what this model to the right here is doing, a standing forward bend test. The only difference is she has her legs crossed for a little more stretch. There's no need to do that. I would just ask that you stand with your feet close together. They don't have to be touching. And keeping your knees as straight as you feel comfortable, you just want to bend forward until you feel a fair amount of pull or restriction. A great goal would be to be able to bring your hands somewhere between the middle of your shin and the floor. If you're not able to get to that place, then there are some stretches you can do to help you achieve more mobility in that plane or in that movement. So we'll go through those things here. So this is a group of stretches that I love to have patients do to help with the mobility of their trunk and their lower extremity. So we'll start with this guy on the left here. This is working on trunk rotation. So if that first test was a little stiff for you, rotating side to side, this is a great way to gently work on that mobility. So bringing the knees side to side, if it feels comfortable to you, maybe you hold the knees to the side and then go to the other side. As an aside, don't worry about remembering all of these exercises. I can email you a printout of these after the presentation, and I'll have a link later on in the presentation to sign up with your email address if you haven't done so already. But back to this exercise, this is called lower trunk rotation. Great exercise to do even before you hop out of bed in the morning. Maybe you do 10 to each side just to get your spine a little bit more mobile and ready for the day. The next exercise here is this guy pulling his knee to his chest. This is a great exercise to work on the mobility of your hip and also some gentle stretching of the muscles in your lower back and behind the hip. This is a great stretch to do, again, maybe before you get out of bed or after activity to really work on the mobility of the lower back and the hip region. The next stretch is this guy here who is pulling his knee kind of across his body. This is a piriformis stretch. This is a really important muscle behind your hip that causes a lot of folks discomfort in their lower back and into their legs. This muscle is very closely related to the sciatic nerve, which bothers a lot of folks. So having good flexibility in this muscle group is really important. And then the exercise to the right here is a hamstring stretch. So this is a great stretch to really help you reach down toward your toes in that, like we did in that previous test. So you can do a hamstring stretch seated. You can also do it standing, just putting your foot up on a chair or a bench, or you can even do it lying on your back. So if you look to the exercise where the man is pulling his knee to his chest, if you want to turn that into a hamstring stretch, you just extend your knee up towards the ceiling with your foot, and then you'll feel a stretch behind your thigh. So those are all great ways to stretch your hamstrings. And I would say 80 to 90% of folks have tight hamstrings and would benefit from stretching them. A word about stretching, you want it to be a gentle pull, never anything more than that. Stretching is something that improves over time. And if you stretch too much, you can actually cause a little bit of tissue damage. So with stretching in the early stages, less is more. And like I said, I can send just a printout of these exercises with recommended repetitions and hold times. So let's look at stability. And I put this photo of the back brace up there, not because I encourage you to wear one of those, but it's really important to build the muscles in your trunk so that they stabilize you in the same way. So a lot of folks, when they think of doing any sort of lifting or heavy work, they think about wearing that back brace. But if you do the work ahead of time and work on strengthening and coordinating the muscles in your trunk, they can replicate the support that you'd get with this brace. So that's a really important thing to do. And it doesn't necessarily mean, that you're preparing to, do a lot of lifting. Any activity throughout the day requires some amount of stability in your lower back. So really important to work on activating and engaging those muscles. So here are two of my go-to stability exercises to start working on building that support belt from the previous slide. So the first one is working on engaging your lower abdominal muscles. And you can do this by thinking about pulling up and in, maybe pulling your belly button down toward your spine. Another cue that works well for people is envisioning that, something is coming at you, maybe a line drive baseball, and you're trying to protect yourself. So you're activating those abdominal muscles, kind of bracing for that impact. So whatever way is most beneficial for you, you're just thinking of tightening those abdominal muscles in the front, maintaining that contraction if you can. 5 seconds is a great starting point for this exercise. And I even go further and say, instead of counting the seconds, maybe do it for 2 breaths. The reason I say that is because I'd never want you to hold your breath while you're activating these muscles. Because ideally, I would want you to transfer this skill to being able to activate these muscles as you're doing activities throughout the day. And certainly I wouldn't advocate for you to hold your breath as you're doing activities throughout the day, So it makes sense to practice with your exercises here. So make sure you're breathing, activating those tummy muscles. If you're having trouble doing it, you can also think about starting by doing what's called a pelvic tilt. So that would be thinking about pushing the belt line down towards the floor, table, or mat that you're on in this position. So rotating your pelvis backward, activating those abdominal muscles. This is a great way to start engaging those muscles. And if you haven't made an effort to engage these muscles recently, don't be surprised if this is challenging. It will be until you start to wake those muscles up and learn how to use them. So another exercise that I really like to give folks for a starting point for stability is a bridge. So that's the exercise to the right here. And essentially what you're doing is you're activating the muscles behind the hips, pushing down through your feet and lifting up off the mat. This is great for activating, like I said, the back of the hips, also some of the muscles that help support your lower back. These are really good muscles to work on because they're very functional. We use them a lot throughout the day, whether we realize it or not. And as far as a bridge is concerned, a great starting point would be to see how you feel with 10. If that feels good, you can consider increasing the hold time or maybe increasing your repetitions. Another word about doing these exercises is you want to do them in a pain-free range of motion. If any of these exercises are painful, that is a sign to hold off or make a modification. So with the bridge, if it's painful to lift as high as this woman in the illustration is doing, maybe you just start by taking 50% of your body weight off the back of your hips. And that's a great starting point. And then from there, you make it your goal to lift completely up off the mat. So all of these things can be modified based on your starting point. So posture, positioning, and body mechanics. So I think we've all at some point in our lives been told to lift with your legs, not with your back. And I would go even further to say that this should be when you're lifting anything. I think a lot of times people think that they only need to use proper posture or body mechanics when you're lifting something that's heavy. But every repetition, regardless of weight, will put stress on your lower back. So think about how many Amazon boxes end up on your front step. So if that's a daily or weekly or however often that happens, that's a lot of repetition of potentially doing something that isn't beneficial for your back, or doing something like laundry or lifting a laundry basket. Really important to think about activating those core muscles that we just talked about and keeping your spine in a good position. So I think the illustration of this gentleman lifting the box is a little exaggeration. Hopefully, we're not lifting with a rounded back, but certainly a good reminder to be mindful of your mechanics. And the other kind of common area that we can work on proper mechanics or positioning is sitting. So I think, at the top of this illustration to the right here, we can see that the person to the left is sitting with poor posture. The person to the right has much more support. Their feet are firmly planted on the floor. Their spine is in a nice neutral position. So if you're sitting this way as you're checking your emails or surfing the web, your joints will be in a much better position. And of course, I think at some point over the course of the last few years, all of us have ended up kind of sitting on the couch, checking our emails and kind of looking similar to this cat here. You think the couch is a squishy, soft place and it'll be very comfortable, and then you go to stand up and maybe it doesn't feel as good. Be mindful of your sitting position. It's really important to put a pillow behind your back if you're on a squishy surface. So give your back a little extra help. In the car, you may have some lumbar support. Use it. Make sure that you're making as much of an effort as you can to keep your spine in a neutral position or a nice straight position as much as you can. And a great way to work on a functional exercise that will help you with lifting is to do a sit to stand from a chair. So if you look at these 3 examples of performing a squat, the form should look pretty similar across the board. So in preparation for maybe lifting that box that gets delivered, using the good form in the illustration in the middle, why not do some sit to stands from a chair without using your arms? Make sure your feet are a little wider than shoulder width apart, and bring yourself up from the chair without using your arms. Maybe you hover right above the chair instead of coming back down to a complete seated position, and that'll really engage those muscles in your thighs. That may be a little advanced, so start where you are, and then maybe you progress it to holding some weight, but this will definitely strengthen the muscles that you can transfer into safer lifting. Certainly you don't have to get to where this woman is on the right, but I just want to demonstrate that squat mechanics across the board, you're doing the same thing, but you can modify it to whichever of those 3 scenarios works best for you. So bringing it all together. It's really important regardless of whether you are trying to avoid back pain or you're currently in pain, to make sure that you work on mobility. A common, mindset is that if your back hurts, you don't move it. And that is actually, in the majority of cases, not a good plan. You don't want things to get tight. We want to maintain that mobility. We need it to do things throughout the day. So I would encourage, some kind of mobility program. If the 4 stretches that we went over work for you, I think that's a great daily routine. If they're painful, of course, hold off. Or maybe, there are other variations of those stretches that would work best for you. Stability. So working on those muscles that support your back. I gave you 2 examples of some stability exercises to get you started. I think it's a great starting place, and then progressing from there to really get to a place where you can transfer the use of those muscles to functional activities that you're doing throughout the day, because that's the important part. And then the other part that we talked about, being smart about your posture and your positioning and using proper body mechanics. So practicing those sit to stands from a chair so that you're able to squat with better form and protect your back and use those strong muscles in your legs so that you're not injuring yourself. So I think this is a great starting point for addressing or preventing back symptoms. Certainly, if this is beneficial for you, I encourage you to continue. If you're looking for a little more guidance, I would be happy to work with you on these things as well. So feel free to use me as a resource. I'm happy to answer any questions about any of these things or any of the back conditions that we discussed. And I have a few more slides here. As I mentioned, I'm happy to send you copies of the exercises that I talked about in the presentation today. If you'd like access to those, you can either scan the code here with your smartphone, and that will bring up a link to sign up, or you can go to the web address at the bottom of the screen here, and there will be a sign up form. So I encourage you to fill that out. Just enter your email address, and I'd be happy to send you a copy of the exercises. And also, certainly you can reply to that email with any questions that you have. I would also love your input on other topics that you'd like to learn about. So other workshops that I can offer to address any issues or any topics that you'd like to have a workshop on. So again, it's capecodbfit.com/OVL back. Another thing I like to mention is that I started a free Facebook group for active women on the Cape. And we're a fun group. We go on hikes, bike rides, we went bowling, rock climbing, we play pickleball. It's free to join us. And we are a social group that likes to have fun and be active. We age range from your 30s to your 80s or beyond. So everyone is welcome to join, and we have a number of events, hopefully that meet everyone's needs there. So join us there. And I guess that's the end of the presentation. So what I would like to do is I had a slide with my email address on it, but I can certainly reach out to you if you sign up for the workshop, and that will give you my contact information. But basically, the best way to get in touch with me, Stephanie with a PH at capecodbfit.com. Like I said, if you have trouble getting in touch with me, feel free to just give me your email address through that sign up form, and I'm happy to reach out to you there. And you can also visit my website, which is capecodbfit.com. Oh, and I guess I can put the email address right in the chat here. Let's see. And I'll put my website. So feel free to reach out to me with any questions. And also, like I said, I'd be happy to help you progress or modify any of these exercises to meet your specific needs. So I'd like to thank everyone for joining us today. I hope you took away some good information about your back and you're able to implement some of the things we went over. And I hope to hear from you. So everyone have a great weekend and take care.